Hey, my name is Matt Blois. You're watching Medically Necessary, a show about the healthcare supply chain. I talk with experts, business leaders, and researchers about how we get drugs, medical devices, and supplies to healthcare providers and patients. This show is brought to you by Ryder, the only fully integrated logistics and transportation provider in the industry. Ryder's solutions cover the entire supply chain, including warehousing, transportation logistics, e-commerce fulfillment, and last mile. Discover how Ryder can make you ever better at ryder.com. And today I'm talking with two leaders from Ryder, Phil Trabulsi, Senior Director of Solutions Design, and Alec Hicks, Group Director Solutions Design. And we're going to be talking about supply chain visibility. So the COVID-19 pandemic put this giant spotlight on the importance of supply chain visibility in the healthcare industry, especially. And I know that I've been reading about and writing about a lot of companies lately that have been investing in better technologies to improve that visibility and really just aim to do that better than what they did before. And the goal is to make these supply chains more resilient, more efficient, combining more complete information about the supply chain with innovative technologies like artificial intelligence, robotics, and just offer more opportunities to improve the supply chain. So I brought Phil and Alec onto the show to discuss the benefits of increasing supply chain visibility and a little bit about the pandemic's effect on this technology and strategies to improve visibility as well. So I want to start with Phil. Let's maybe just get a sense of which parts of the healthcare supply chain have more generally higher visibility, and then which parts of the supply chain are harder to see, are hard to get a handle on.
Sure. Yeah. So visibility effectiveness, it varies between whether you're a shipper, a carrier, consignee. Various components make an impact on visibility. In my career, I have managed end-to-end supply chains all the way from factory gate to final destination. And I can say, based on my experience, that the international supply chain has much greater visibility than the domestic LTL and TL supply chain. Typically, the reason is in the international space, you've got a smaller number of players, large corporations that have built platforms and adhere to standards for providing visibility in that space. While in the domestic space, you've got over 10,000 LTL, TL carriers. The standards are there, but it's very difficult to get 10,000 participants to adhere to standards such as EDI, electronic data communication, things like that. So in the international space, these larger providers have created these platforms, and they are able to provide this visibility, and their customers can benefit from it. On the domestic space, a lot of things are done manually still, and it can be quite challenging due to the large number of transactions and number of players in that space.
Yeah. I don't think I'd heard anybody make that comparison before, but I think it makes a lot of sense just based on what you said on sort of the number of players involved and the how complicated it can be to get 10,000 organizations on the same page versus just a few. I want to turn it over to Alec now. How can healthcare companies or logistics providers who serve them get a more complete picture of those areas that have less visibility in the supply chain?
Sure, good question. So collaborators between all those stakeholders that Phil mentioned in the healthcare supply chain is a little more complex. The healthcare supply chains are traditionally siloed and fragmented, and as I mentioned earlier, complex. And the critical nature of their products forces the healthcare companies to require accurate and timely updates and analytics on the movement of their goods through the supply chain and across all their provider base. In order to improve this visibility, shippers and logistics providers need to focus on breaking down those traditional silos and collaborating to bring visibility across that supply chain. This can be done in a couple ways, but a key component of it is having a digital platform that can provide that visibility across silos and give all parties the ability to see and act on the movement of those goods throughout the supply chain. This drives the sharing of actionable data with all those involved parties and enables them to make timely decisions and take actions on exceptions while their goods are in transit. This is what drove Ryder to launch RiderShare in 2020.
Yeah, that makes a lot of sense. Well, and I think both you and Phil have brought that up now. Just sort of the there's these silos, and then there's just a lot of organizations that are involved. I mean, when you zoom out and look at Phil was saying that 10,000 number of all the organizations that are a part of all supply chains, but even just within a single supply chain, there's this challenge of making sure that every partner along the whole supply chain has the same information and access to the information. So I want to just follow up on that by asking, what's the best way to share this information? Because a lot of times this information is going between companies, different companies that might have different policies or different ways they do things. So what's the best way to share that information in a way that's sort of fair to all the different companies that are in the supply chain, but also benefits everybody in the supply chain?
Sure, that's a good question, and an important point is that it's not all electronic. The collaboration between the stakeholders is really critical to ensure that those logistics processes work effectively and are enabling our healthcare clients to provide excellent patient care. When you have a control tower in place, supply chain information is available to share according to the business rules that those stakeholders, typically shippers, carriers, consignees, and so on, have established. RiderShare takes this further by allowing all those parties to see the same data that everybody in the supply chain is looking at in real time or near real time. So now everybody has the same information and can act on it. This along with the collaboration, having the technology that can effectively aggregate, organize, and analyze the disparate data and transaction sets that are flying, through the supply chain between those stakeholders is really essential in identifying the trends and opportunities to improve how that supply chain performs and how the carriers are providing within that supply chain are performing. In other words, enabling folks to drive continuous improvement across the supply chain. Finally, providing that data visibility across all the parties enables the collaboration, the real-time decision making, and giving the benefit across all those parties in the supply chain, which in turn drives benefits for all and encourages collaboration between those parties.
Yeah, I think that makes a lot of sense. Phil, I want to go back to you. I want to ask a question about what do you do with this data? Because collecting the data is obviously only step one. And then I've said a couple times on this podcast before, it doesn't do you any good to just sit there and admire it. And so you actually have to use it to make some sort of business decision. So how can healthcare companies or logistics companies transform that data into something that's a useful business decision?
Sure. Yeah. I mean, it's a great question. There's so much data collected within the supply chain or available to be collected in the supply chain. It's really hard to know exactly where to focus your attention, what to do next with all that data. It really is a maturity process. So lower maturity companies collect data but don't know what to do with it. As you establish platforms and control towers, you begin to put in place what I call exception management. So exception management, with the aid of a good platform, helps weed out the things that don't need attention from the things that do need attention. It allows you to focus on where there may be problems or upcoming problems within the supply chain. As Alec mentioned earlier, you're operating the supply chain according to business rules. So if there are certain things that become out of tolerance, for example, if the shipment is not picked up on time or within the time window necessary, the platforms can flag that as something that needs attention. So then you can dedicate your resources to focusing on the things that require intervention as opposed to things that are just going along smoothly. So it is a maturity process. The first thing really that needs to be put in place is the ability to focus on exceptions and manage exceptions. From there, putting resources in place such as data scientists, analytics and analysts to work with that data and drive reporting to be able to push out to the various players within the supply chain. So you can actually use your platform to provide reporting to your carriers and other service providers as to their performance. You can see who the leaders are and who the laggers are and begin to manage the players within the supply chain with the data. But it really starts with taking those business rules, formulating what the exceptions are, and then using a platform to flag those exceptions so you can take action.
Yeah, I feel like that's a really good way to think about it. I mean, like you're saying, if things are running along smoothly, it doesn't make a ton of sense to spend time, energy, and resources to just watch things run smoothly. You want to go straight to the problem areas and come up with a solution for that. And the faster you can do that, the better. And I think this will tie in a little bit to. I think this question sort of in the background of everything you guys have been talking about already, but I wanted to ask about automation. And so, Phil, how's warehouse automation contributing to making these supply chains more resilient and more efficient?
Yeah, over the past 2 years, automation has really become a major focus. Not that it hasn't been before that, but in the past 2 years, with everything going on with labor availability and things like that. So within the warehouse, there's been tremendous breakthroughs in automation. What used to be just a high-speed conveyor or sortation is now automation is consisting of AMRs or robotics to help aid in the warehouse tasks. We look at high-density storage with bots to retrieve product instead of sending humans to go get something. We can actually program bots to go get product, bring it to the person. We call it goods to person type technology. And getting that greater storage density has helped to shrink the footprint of warehouses. So it's a combination of that automation helping to speed the process along and also shrink the footprint. And then the final component of that is scalability. Automation has helped supply chains become more scalable because you can size that automation to handle the peak volumes and handle whatever surges may be coming along so that you can scale without having to bring lots of resources in and then figure out what to do when the volume goes down. That's especially true in the e-commerce space, but in healthcare with time critical product, it's extremely important to be able to scale and maintain service levels, and automation relative to bots that support the operation or speed those processes along have really become a major focus within the healthcare space. Yeah,
that's super interesting to think about. Well, and I want to, while we're on that, I want to go back over to Alec and just ask about, what comes next? I mean, we're already talking about robots. So what's on the horizon when it comes to supply chain visibility technologies? What kind of technologies are we going to use in the future?
That's a really good question. First, to add on to what Phil said, I think we expect to continue to see an acceleration in automation, both the capabilities of the automation and the capital investment or the cost of entry for that automation to come down relative to other costs. So I think you'll see more of it deployed, over the next several years. Secondly, when we get back to the broader supply chain, I think we'll continue to see expansion of IoT technologies. I think we'll see that sensors will become increasingly cheaper or less expensive and more capable at the same time, and that's going to allow us to capture more real-time information within the supply chain. So, for example, if you look at the product level, we expect to be able to more easily track. If you think of the healthcare space, a product that requires temperature control, we'll be able to track, temperature control at the pallet or the case level more effectively and communicate that to the stakeholders within the supply chain. We'll be able to provide greater security at the goods level, whether it be with a tractor and trailer moving down the road, a rail car, or within a distribution center will be able to protect goods and assure the folks, either the consignee or the shipper, that their goods are secure and not being tampered with. And then I think the real-time status updates of products or orders within the supply chain will become more detailed and more timely as this IoT technology continues to improve.
All right, so those are the main questions that I had planned out that I wanted to ask you guys, but I like to end a lot of my interviews by just asking if there's anything else, any point that we didn't bring up that you guys wanted to get to, or just some issue that you think is really important when you're looking forward in terms of supply chain visibility that you wanted to talk about. Phil, do you have anything you wanted to bring up at the end here?
Yeah, thanks. One thing that I think is important to note, some of the trends that we're seeing within healthcare networks, specifically hospital networks, is that larger hospital networks are moving more to the direct sourcing model, meaning that in the past they've procured a lot of their supplies, the vast majority of their supplies, through distributors. And hospital networks are trending more towards direct sourcing. And what that means is that now these hospital networks have to learn how to manage inventory, learn how to run warehouses, learn how to schedule deliveries and routings and things like that. We've helped several networks in this space, and it ties back to the automation comment earlier. As hospital networks get into this space of managing warehouses, they also need to learn and become experts in automation and how that applies in the warehouse. Choosing the right automation can be incredibly beneficial within the operation of these warehouses. Choosing the wrong automation can actually be detrimental. And we've partnered with many hospital providers to help create that path and to help work through those decisions when it comes to operating warehousing for companies that traditionally haven't done that in the past. So I think that's really an important trend that we're seeing lately.
Yeah. Alec, what about you? Did you have any other sort of forward-looking things that you wanted to bring up that we didn't get to?
Sure, thanks, Matt. And I think one of the things that's making those healthcare companies more comfortable taking more control over the supply chain is the capability of the visibility platforms. The platforms like RiderShare are increasingly integrated with the various execution systems, be that a warehouse management system, a transportation management system, or an ESRP, operated by the stakeholders in the supply chain, as well as being aligned with related exception management processes. That ability to integrate and then to provide that real-time information on a mobile device is allowing people to make even more effective and more timely decisions. Something's happening to an order or a product, 24 hours a day, 7 days a week as it moves through the supply chain, and that ability to integrate with mobile devices and give the decision makers in the supply chain to make more timely decisions based on those real-time updates is going to continue to drive the more effective execution of the transactions that it takes to get a healthcare product from the shipper to the patient.
Yeah. Great. Well, thank you guys. I just want to thank you both again for coming on to the show and talking with me. I feel like this has been a great conversation. I hope the listeners got as much out of this as I did. So thank you guys for coming on the show. This has been great.
Thanks, Matt.
Thanks, Matt.
All right. And thank you, everybody, for watching. This has been Medically Necessary. You can catch us next week on Thursdays on FreightWaves TV. Thanks.
Thanks again to our sponsor, Ryder, for making this show possible. The coronavirus pandemic has changed many aspects of the healthcare supply chain, but Ryder is prepared to help customers respond to these changes by offering solutions through the full supply chain. Discover how Ryder can make you ever better at Ryder.com.